All right, hi Fosters, Kayla here with Dr. Lisa. We have another topic to talk about today, and that topic being our current coccidia and giardia, or just intestinal bacteria, bugs. So we wanted to touch on this topic because I know that it's something that I deal with and answer questions for you Fosters, but I know it's for sure a topic that the vet team deals with pretty frequently. So we wanted to kind of discuss just a few things about it, and hopefully it might answer some questions or concerns that you guys have. And one of my first questions I have for Dr. Lisa is, how can fosters tell if their foster dog has an intestinal parasite or bacteria?
Okay, so probably the number one symptom you're going to look for would be diarrhea in your foster dog. Now we do see diarrhea a lot of times in the dogs that we take in simply because they have just abruptly changed their environment, their diet, from whatever they had been eating to what we're feeding them. So that in and itself can cause diarrhea too. But if you're seeing diarrhea, especially with any kind of mucus or blood to it, or if it's getting worse rather than better, and that really, really runny stuff and really foul smelling stuff, sometimes that can be an indication that there's a parasite of some sort in there. Obviously you might see worms in the stool, and we do see worms, we expect to see worms. Those are actually less likely to cause diarrhea than the giardia and the coccidia that we see. Worms tend to not cause as much of the diarrhea as the other littler parasites do that you can't see with your eyes.
Awesome. So how could I confirm if my dog had one of these things?
Yeah, so the best way is for us to check a stool sample. We have some really nice artificial intelligence, computerized fecal screening devices
fancy.
Here. They're pretty fancy.
Yeah.
And so you bring us a fresh stool sample, and by fresh, just that day preferably, and not frozen if it's winter. Doesn't have to be like less than 5 minutes or anything like that. Just so it's nice and soft and about room temperature. We'll run it through the machine, and the machine's really good at catching giardia and coccidia, which are both really microscopic little organisms that you would never see with your bare eye. And so that's the best way for us to tell. There's really no other good way. There are some snap tests out there that used to be used for giardia, but they're actually not super helpful because they're really too sensitive, so we got a lot of false positives, and you have to follow that up with the actual smear anyway. So we just go straight to the test, the AI test that we use that looks for the actual cysts.
It is pretty fancy. It's I think better at catching these things than even just a human looking at a stool sample.
Yeah, it's pretty cool. They say it's used all over the world, and every time it runs a sample, it learns. And so there's this huge database of it comparing what an actual giardia looks like to what we're seeing. So it's very accurate.
Awesome. So an ideal time to be bringing this stool sample in, if it's not an urgent matter and we want to make an extra trip, we want to, no matter what, bring one to a normal intake exam.
Correct. And I know this is a bit of a change for some of you that have been with us for a while. We were having you bring a stool sample at the time of surgery, but we've kind of decided that it makes a little bit more sense to do it earlier on. So, when they get here, we know that they're going to, like I said, have maybe some upset stomach from the change in the diet. So if they've been in your home for a couple of days, that's the best time to have that intake exam done with. They've settled in a little bit, had a couple of normal meals, bring that stool sample in on their very first exam. That way we can run it and know if we need to start treatment on something prior to them coming in for their spay or neuter surgery. Most of the giardia and the coccidia in particular take advantage of an animal having kind of a weakened immune system, and so surgery is always going to be something that's going to command a lot of attention from the immune system, so we want to make sure if we can to clear any parasites out before we put them through surgery.
Awesome. So and something to mention too, I talked to Lisa about this earlier, I know that my dogs can even be exposed to them because my foster dog has something, and they can even be positive for something like coccidia, but not even be showing symptoms for it. So no matter what, we want to bring a stool sample in, no matter what it looks like. And then what would a normal protocol be for when we do see a positive for these two things?
Yeah, that's a great question. So there's actually a group of veterinarians, and they form a group called the Companion Animal Parasite Council, or CAPC. And their job is to follow and study companion animal parasites, or dog and cat, probably other things too, but parasites of these animals. They track them, they trace them, they do research on what's treatable, what's best to treat with, if we have to treat it all. And so all of our recommendations at COPOS comes directly from this organization. And that being said, asymptomatic dogs with giardia or coccidia are not recommended to be treated. So what that means is if you bring us a stool sample, dog's going, once or twice a day, totally normal stools, no problems, no diarrhea, no upset stomach, nothing, and we found, a couple of cysts in there, we're probably not going to treat. Because two things, giardia can be hard to treat, and if it's not symptomatic, it doesn't make sense to put that medication into the animal, because then we can actually have resistant strains pop up. And then coccidia, the treatment actually for coccidia doesn't even kill the coccidia. What it's called is a coccidiostat. So it slows their reproduction down so that the body can take care of it. And so basically, if you see a coccidia spore in a normal stool sample, you can kind of ignore it because the body will take care of it. And they're going to get exposed to it, like Kayla said. If you've had puppies in your home, you probably have had some coccidia in your yard, and maybe your dogs have been exposed to it. Maybe your dog's got it and got rid of it and you never even knew. So that's one of the reasons that we don't always treat if we see a couple of little spores.
Awesome. So when my dog, let's say a foster dog, is being treated for coccidia, and we have foster homes that are worried about exposure at home. Like you mentioned, I think the number one thing to remember is if your dog is healthy and has a strong immune system, they may be exposed, but may not even show symptoms for it. But in order to lessen exposure, what's the number one thing to do at home?
Clean up. Most of these parasites, so coccidia comes generally speaking from the fecal samples of other animals that have passed on giardia in the wild that can carry it. It can also be obtained from eating mice and rodents and predation and things. So we know our dogs are probably not doing that in our homes, but they probably have before we got them, especially when they're these rural dogs that have been fending for themselves. There's a good chance they've been eating rabbits and squirrels and things like that. So they can get coccidia from those things. So picking up the stool, number one thing. As far as like decontamination, with coccidia, they will die when it's freezing. And you can use bleach if you have to, but really if you just clean up the actual physical stool, then you're not going to have a lot of cysts laying around. And giardia is a little bit easier to clean up. It's not as resistant. It doesn't have that spore to it, so it doesn't stick in the environment too much longer. So just basically clean up your yard. I know it's hard. I have way too many dogs to pick up every time.
Me too.
Personally. But if you're worried, that's what you have to do is just pick up that poop and throw it in the trash so it's not out there for anyone else to get it in.
So something they could even do specifically, especially if you have quite a few dogs, is that dog specifically be cleaning up,
Yes.
after that one specifically. So if my dog is being treated for either of these things, can they still be adopted? This question comes up quite a bit. They've got a pending adoption and they came in to be fixed, and now we're, they could technically be adopted 3 days later, but now we have coccidia. So what's the process? Can they still be adopted?
They can, and so that kind of brings us back to an earlier topic we did about wanting to have the stool samples brought in at the time of intake, because that way we'll know ahead of time, right? So we have your intake exam done, and then we're like, oh, there's coccidia, and oh yeah, the stools are a little bit loose, or maybe there's some blood in them. We're going to treat that so that by the time they come in for their surgery, hopefully it's cleared up by then and they can go home without having to worry about that. But yes, if we don't get a stool sample before we do surgery and we happen to run one and we happen to find something but it's not symptomatic, or even if it is symptomatic and we start treatment, they can be adopted out. These are very common parasites. No vet's going to be surprised to see an animal come in through their doors that has been rescued by a rescue such as us that has some parasites. Now, if they're really, really sick and they're not doing well, that's a different story. But if they're doing fine and we've just started them on some meds for some bugs that we found in their stool, absolutely they can be adopted.
So if they're healthy, improving even, adopters, I would just make sure fosters, we always say get things in writing, so send an email for sure. This isn't something to kind of drop on an adopter's lap at the adoption, but prior to the adoption, definitely send an email, say, hey, guess what, the doc found these, we're treating for it, and if you're still comfortable moving forward with that adoption, we can still proceed with it. And that should be good on our end. But I think that's really the only, is there anything, I know that there's been a drug specifically that has helped my dogs with diarrhea in the past, that some fosters, I think, automatically assume that they will be leaving with, and that's metronidazole, which is an awesome drug, but it's not needed every time.
It's not, yeah, and again, that's going back to kind of taking taking note from the experts in the fields about how to treat things. It's really important that at Coco's Heart, our vet clinic is top notch. So I always want to make sure to follow the experts' advice on treatment. And that's one of the reasons that we do follow the CAPC guidelines for treatment. The other thing is metronidazole, like Pia said, it is a good drug. More recent studies have shown that it actually isn't as effective in treating your run-of-the-mill diarrhea as we once thought that it was. We always do bland diet, so we either give you prescription diet or give you some boiled rice, chicken, that kind of thing. Just some GI rest tends to be the best way to go about kind of non-infectious diarrhea. And studies are starting to show that giving puppies in particular antibiotics, which metronidazole is an antibiotic, as is Albon, the treatment for coccidia. Those are both actually antibiotics. What we can actually cause inadvertently is that puppy's immune system, or its GI tract, it's going to get complicated, its intestinal tract is going to be exposed to this antibiotic, right? And so the normal gut flora that lives there is going to be altered by this antibiotic at a young age. And they're starting to think that later on in life, that's why some of these dogs are having inflammatory bowel disease or food allergies from their guts, or even skin allergies, because all the lymphatic system is really connected to that gut and its normal biome. So if we mess that up at a young age, we can really cause problems down the line. So we're not trying to withhold treatment for your puppy. We might suggest plant diet. We might suggest kale and pectin is another drug that we use for diarrhea. It's just kind of a gel, kind of helps gel the stool. We've also started using kind of a charcoal product. It's called Endosorb, and that kind of helps absorb any toxins or weird stuff that might be in their gut. And those two things can sometimes help quite a bit with diarrhea. And then there's also probiotics, which honestly the jury's out. There's not a lot of good research saying that it helps, but it can't hurt. So those are the things we might send your way for diarrhea that doesn't have any kind of positive findings on the fecal. We may or may use metronidazole if we're not able to get anywhere with those things, but that's why we're not just necessarily giving metronidazole out like it's candy, because we don't want to cause any harm later in life if we can avoid it.
I agree. Awesome tips. And if you guys have any questions about these parasites specifically, or bacteria, let us know. And if we can help answer anything else related to our fun stool samples, we will be happy to answer them. All right, thank you. Bye-bye.